Hello, my name is Dr. Jose Luis Ruiz, and I'm the director of Los Angeles Institute of Clinical Dentistry. And I would like to share with you the technique of the week. And this week is about getting better seal for our composites, our restorations. How can we make sure that our restorations are properly sealed and that the restorations will last longer, the chances of post-op sensitivity will decrease? This is a technique that you may be aware of. In my practice for many years, over a decade, I've been using self-edge bonding systems. And we know that self-edge bonding systems have the advantage of minimizing post-op sensitivity. This is well researched, and although some people might disagree, the great majority of the profession does agree that self-edge bonding systems are designed in a way where post-op sensitivity is decreased when properly used. The disadvantage that these bonding systems have is that they are not very good at etching and cut enamel, and even cut enamel the etching is not as good because they are made out of resin that is very acidic, but it's not acidic enough, not as acidic as phosphoric acid. So for over 10 years, after some research that I did in Germany and published, for over 10 years I have been selectively etching the dentin, etching the enamel in order to increase the seal and the bond strength to the enamel on the periphery. What does that do? It gives me ideal seal, ideal bond strength to enamel, and by using a self-edge bonding system, it decreases the sensitivity. So I encourage you, this photograph right here that you see, you can see how I selectively etch the enamel. And then after that, I will rinse with water. Then I will dry. And of course, because I'm using a self-edge bonding system, it doesn't have to be the perfect level of moisture that we are used to using if we use total edge bonding system. So if it's a little wet, if it's a little dry, it's going to be okay. Then I will apply my primer. In this particular case, I'm using Clearfill SC Protect from Carrare. And this primer is an acidic primer, and I will apply it over the entire preparation. I will apply it over the enamel and the dentin for 25 seconds. The next step is incredibly important. Make sure that you remove the solvent, and the way you make sure that you remove the solvent is you blow air on the tooth, and of course on the solvent on the primer. And you will see that at the beginning it will move because this is a liquid. But then as you keep blowing on it, it could be 5 seconds, it could be 7 seconds, you will notice that it will stop moving. When it stops moving is when you have removed all the solvent. Immediately after that, if I'm using a Clearfill SC Protect, I will apply the second component, which is the unfilled resin. And this material is not highly filled, so make sure the layer is not too thick. So a thin layer is desirable, and cure, and then place your composite. And again, by etching the enamel, you will increase in your seal and your bond strength to enamel. And by using a self-edge bonding system, you'll decrease your sensitivity. Thank you for listening. And if you want more information and more details, I encourage you to visit our website and look for our upcoming course on direct composite, which I can guarantee you will not be sorry to take. This is an excellent course. Have a nice day and look forward to seeing you again.